I'll introduce our guest speaker, Dr. Natalie Anderson. And Natalie has a PhD in public health, a master's in child health research, and a Bachelor of Science in human biology. She's an experienced medical researcher in the pediatric respiratory medicine field, using in silico and experimental methods. She's currently a postdoctoral researcher, science outreach consultant for AFSA, and on the editorial board for Alternatives to Laboratory Animals. So Natalie has been with us for just over 3 years, and really the central purpose of the role is liaison with the relevant stakeholders to progress the uptake of scientifically valid non-animal methods of research in science and teaching. So it's involving developing, maintaining and strengthening relationships, which can be very broad, from animal ethics committees to vice chancellors of universities, for example, to present at forums and conferences, create and distribute AFSA resources. And again, these are also quite broad. So we have bulletins, web pages, briefings, reports, our podcasts, and a number of web pages, which Natalie will talk about later. She also is involved in inputting into our submissions, and these may be regarding research funding or regulatory guidelines, and serves as scientific expertise to the organisation to ensure that we maintain AFSA as a credible organisation. And there are many challenges to overcoming the current status in Australia, which currently favours animal models in research, which Natalie will discuss in her presentation. But equally, there are very tangible solutions. It's very clear that we won't create change without engagement and collaboration with the research sector. And it's really become, in the course of this role, very personally clear to me that the policy positions of the research peak bodies or the associations will hold more sway with the decision makers we are trying to influence than us as an advocacy organisation. So where we can align on shared objectives, this will bring benefit to the animals we wish to protect, as well as advancing human health outcomes. So with that, I will hand over to Natalie.
Thanks, Rachel. Thanks very much for the intro. I'm just going to, spotlight me and share the slides. Bear with me a few moments, everyone. Okay, can somebody give me a thumbs up that you can see the slides? Thanks, Adam, and hopefully I spotlighted that okay. Thank you. Thanks, Belinda. So yeah, thank you for inviting me to speak this evening, and I'll be giving a little bit of an overview, very brief overview on the landscape of non-animal research methods in Australia. So I'll briefly introduce you to some of the terminology used in non-animal models, go through the landscape of the methods used in Australia and looking a little bit into funding and infrastructure, and a little bit of an overview of the current AFSA campaign to support non-animal research methods and what you can do. So I think that's going to be in the way there. So yeah, you will hear quite often the terminology non-animal methods referred to as NAMs, non-animal technologies are referred to as NATs, and for this talk I'll be using NAMs predominantly. And the key ones that you will come across are in vitro and in silico, or in vitro meaning biological, where biological components are used or grown outside of the body or outside their natural environment. And these or the three key ones in this area are organoids, organ on chip, or also known as microphysiological systems, and body on chip, which is just combining all the organ on chips together. Computational examples or in silico examples include using various different types of computational methods for chemical hazard and chemical risk assessment, using physiologically based pharmacokinetics modelling. So that is looking at the absorption, distribution, metabolism, excretion and toxicity of a drug or a compound in the body. And an example of this that you may have come across is the virtual second species, or the virtual dog. And then we've got the virtual physiological human, or the virtual human twin, as it's being referred to now. And that's sort of a digital technology that's rapidly advancing, that sort of can be used in clinical trials. And yeah, just wanting to sort of outline those, but we won't go into any of those today. If you want to know more about any of the particular non-animal models in more detail, we do have a report called Better Ways to Do Research, and this is an overview of all the methods and technologies that can replace animals in biomedical research and teaching. So you can access that via the QR code, or I've got a link later on what page that is on in our website. So just a brief overview of the background. Obviously, it's extremely complex to cover the whole of Australia, and everything is very rapidly changing as well. But there's a few key reports, and there are already several key centres, hubs, and infrastructures that I wanted to sort of go into a little bit today. So the first key report that you may have come across, or you may like to look at, is the CSIRO Futures Non-Animal Model Strategy for Australia. We'll go into that a little bit more on the next slide, but that was released last year, and that was sort of a really big event in the scientific world, I think, that helps give confidence to these new non-animal models. And then in 2012, there was a report prepared for the Australian Department of Health and Aged Care, Commonwealth Health and Aged Care, and that was sort of outlining a little bit on the alternatives to animal models in Australia for the purpose of testing industrial chemicals. And then there's centres, hubs, and infrastructure. So these are really key. Without these, can't really progress these non-animal models. And the key ones that are showing up really throughout Australia at the moment are specific to organoid development. So we've got the Monash Organoid Program, which was established around the 2017. And they sort of host one of the largest organoid symposiums in Australia as well. We've got the Centre for Personalised Therapeutics Technologies, and that was funded around the 2020s, I think, and that is sort of they specialise in microphysiological systems, or the organ-on-chip systems. Then there's the Australian Organoid Facility at the University of Queensland, which was up and running since 2022. Then earlier this year, we had the announcement of the establishment for the Non-Animal Technology Network, or the NatNet, in New South Wales, and this was a result of the funding that was announced by the New South Wales government due to the parliamentary inquiry in 2021-22 on the use of animals in medical research. And so this is funded to by $4.5 million of that 7 million that was announced. Then we've got New South Wales Organoid Innovation Hub, WA Organoid Innovation Hub, and there's also a Centre for Next Gen Technologies and Biomedical Analysis in WA, and the Phenomics Australia have in vitro hubs Australia-wide to try and focus on these non-animal models. So yeah, that's just a really brief overview. There's probably a lot more going on than this, and various different symposiums as well, which are really key to helping international collaboration and national collaboration. But these are just sort of some of the key ones, and you can see a bit of a timeline for how sort of new this area is. So the CSIRO Futures Non-Animal Model Strategy was released, as I mentioned, last year, and they outlined 10 key recommendations. And I've just got a few quotes here from the strategy, but it's a really good document worth having a read. And basically they're saying Australia must act now to secure a key role in this emerging capability, where they're referring to non-animal models, specifically organoids and organ-on-chips as well. They didn't sort of go into detail on the in silico methods in this particular report. And they've stated that the next 15 years will see an increase in the use of non-animal models across all stages of medical product development process. And so hoping that there's going to be the animal models are going to be phased out at the same time. But at this stage, there's no clear roadmap in Australia to do this, really, despite this excellent report. So they estimate their benefit to the economy. Obviously, that's the purpose of CSIRO Futures, to look at where the economy is headed. So organoids are predicted to bring in 1.3 billion if Australia can act now on this by 2040, I think that is, an organ on chip 310 million AUD. So there's clearly benefit to the economy to be moving to non-animal models. So that was a little bit of an overview of what we do have. So we have several reports, we have a lot of infrastructure, although that's fairly new and emerging, and some even, I think the New South Wales Organoid Innovation Hub is still being built even. So it is very new, and there are several issues that have sort of been barrier over the years and continue to be a barrier to more progress in this area. So the number one issue, obviously, is money. There is no federally funded scheme dedicated to non-animal models. Our primary, the National Health and Medical Research Council, is the main body responsible for funding medical research, although they have stated in personal communications with Rachel that the endowment fund prohibits funding purely for non-animal purposes through this fund. The second biggest funder is the Medical Research Future Fund, or I think actually number-wise perhaps there's more money available in this fund, but they follow certain strategies, so the Australian Medical Research and Innovation Strategy and the Australian Medical Research and Innovation Priorities. And unfortunately, neither of those the strategy or the priorities prioritises non-animal models at this stage. Hopefully, a new one will be released and it's on that radar. So the other key issue or barrier is that there's no Australian Centre for Alternatives to Animal Testing. There are, I think, over 10 internationally. The first one was established in Germany, at Johns Hopkins University in the US, and they have a sister centre in Germany at Constance University. So they were established around the early 1980s. We also don't have a phase-out roadmap, which several other countries and or major jurisdictions do have worldwide. So these are two really key, or three really key things: funding, an Australian Centre for Alternatives, and a phase-out roadmap are three sort of key pieces of work or infrastructure that we need to be able to really get stuck into this. There is one university offering funding for 3 Rs, which is actually considerable, around the $250,000 mark. But unfortunately, they're the only university in Australia that offers anywhere near that much. So yeah, we've got a little bit of a ways to go here on this. And the other key issue, although these are sort of a bit broader than just Australia, but in the Therapeutic Goods Administration in Australia states there is no mandate to use animals in drug development, but there is also no clear guidance or pathway to what it looks like to use the non-animal models in drug development. And the guidelines that do currently exist are very it's very much implied that you should be using animals. So we need a little bit of clearer guidance there, much more clearer guidance, sorry. And although Australia does have the ability to adopt European Medicines Agency guidelines, not that many so far of the ones that could help facilitate using the alternatives are adopted here in Australia. Obviously, the United States has the biggest pharmaceutical market, and most people will want to launch on several their drug on several markets. The US being one of them, as it's the biggest, and the US does have the FDA Modernization Act 2.0. So this no longer mandates the use of animals for pharmaceutical development, and it explicitly states which non-clinical, non-animal models can be used as well, but there is still some work to do in the US as well. So just to overview what we've just discussed, you can read this article in The Guardian that sort of highlights some of the issues in Australia and talks about what we need to do here to not lag behind internationally. And there's also a link there to a scientific article that Rachel and I have published, which talks about the landscape in Australia and some recommendations for how we can progress. So now I just wanted to highlight to you, you may already be aware of this, but in case you're not, it's our I Am Not a Lab tool campaign. The ask is for federal funding for a Centre for Alternatives to Animal Testing and money for development of alternative non-animal models. Earlier this year, we partnered with Lush Cosmetics to raise awareness for this campaign there were over 7,000 signatories, postcard signatories throughout Australia, and 22,000, including emails, were sent to promote this campaign. We also earlier this year briefed the WA Legislative Assembly on this issue and made a submission of a WA inquiry into priorities for medical research in WA. So what you can do is support the I Am Not a Lab tool campaign. That QR code goes to our webpage for more details. Can serve on animal ethics committees, encourage the use of our alternative search service. So earlier this year, I did a talk at the New South Wales Animal Research Review Panel 3Rs webinar, and the link to that video, where I talked about our alternative search service, and I also presented on that at AnswerCart, but that one's not publicly available, that video. So that video is available from a New South Wales Animal Research Review Panel on our webpage for researchers. And obviously you can always participate in human research studies. So with that, I'd like to thank you for helping us to work together for our vision for a future where no animals are harmed in the name of science, and scientific progress is advanced through animal-free research methods. And you can feel free to reach out and contact me.
We've got Elizabeth asking, she says, I'm an activist and I want to know if the problem is awareness amongst decision makers, vested interests, or something else.
I think it's probably a combination. It depends on which decision maker. Some of it, I would say, would be lack of awareness. It's just not on the radar as an issue. For some, it may be a case of lack of skills or training in the non-animal research methods, or lack of infrastructure or funding to develop those particular methods. For others, it may be a case of there's pressure on them to use animals from their supervisors or the publishers or the editors. So a range of different pressures on them to continue using animals. I think it's starting to change as there's a global shift towards non-animal methods. So I think that the awareness is slowly shifting, and there's definitely young researchers that are pushing against this status quo. In terms of vested interests, I would say there probably is some vested interest from those who supply animals or profit from using animals. Most of the large animal suppliers are outside of Australia, but there still are animal breeding facilities in Australia and primate breeding colonies, and some money to be made from that industry. So would have some part to play as well, I would say.
I can also add, I think the commercialisation and is being really pushed in universities, and so when you're thinking about pharmaceutical development, unless there are clear guidelines from the Therapeutic Goods Administration, or they're able to follow the European Medicines Agency guidelines, then it is a bit tricky, because yeah, if you're looking to commercialize your biomedical product, you will need to use animals at some point if that's what the guideline says. So that's sort of a little bit of a tricky spot as well, when there's no clear guidance on what types of alternatives can be used, and what that pathway looks like for drug development using the non-animal models. But having said that, hopefully we will see some progress with the non-animal technology network in New South Wales, and I know that it was part of the NHMRC priorities to look for emerging technologies, and New South Wales was definitely doing that. So yeah, I think it is a priority to do that in at least some states. But yeah, I'll leave it there.
Yeah, and I think I'd add too that while there might not be huge awareness amongst decision makers, we have an action on the I Am Not a Lab Tool webpage, which you can send an email to your local MP, which has a few links in there. There's a lot more information it directs them to on the I Am Not a Lab Tool page as well. And even though some of the responses we've been forwarded have been a little bit generic, we have had responses from MPs as well. So those kinds of actions put it on their radars. So if there wasn't awareness previously, even if they have sent us a very generic email, it's at least within their attention after that.
I mean, another area of work that we are quite active in is regulatory guidelines. So if we notice that there is a guideline in Europe which hasn't been updated here, then we will bring it to the attention of the TGA to try and remove animals being used unnecessarily. And we're part of an international network for both regulatory and pharmaceutical therapeutics to try and harmonise those and improve the uptake of non-animal methods in those guidelines. So we're quite active in that field, or increasingly active in the last 12 months.
So I was just going to say, Adam, I can see Susan's question. Is it true that the animal testing industry is a multi-billion-dollar industry? And I'm going to take a hint and guess and say yes, but I'm not sure of the exact figures.
Yep, I don't know the international figures, but most definitely it would be. I mean, it's I can't remember what's the figure that's quoted to bring a drug to development is over $1 billion, isn't it? So
yeah, in the range of I think 1 billion to 4 billion, or up to 10 billion even sometimes.
Yeah.
So yeah.
And there's another question from Susan too. Are there any up-to-date video from Australian facilities to show people as evidence as a tool for raising awareness? I don't know that we have much, if any, up-to-date videos as such. I know social media in particular is quite good for seeing these, that researchers do show off their labs quite a bit, and often you can see animals used in the background, but as far as the actual procedures used on animals, I'm not aware of at least any significant videos like we would see from organizations in the US, or in the last couple of years from Spain, for example.
Yeah.
And Elizabeth has another question. What role do veterinary practitioners have to influence the people deciding whether to test on animals?
But just from what I've heard, so animal welfare officers in universities, for example, they sort of have fairly little say over what's actually going on. It's the researchers. If the researchers are doing the work, then they, that's their job to look after those animals. So although it is, having said that, in the animal welfare officer's role to look for to implement the 3 R's. So they should be looking for alternatives, and lots of the animal welfare officers that I've spoken to, that they're very open to speaking to me because they know that that's part of their job role. So yeah, I think it's just a case of, unfortunately, if the research has been approved by the ethics committee, yeah, there's not so much that they can do at that stage. But perhaps during the ethics committee, there may that may be the biggest point to be influential as the veterinary member of the ethics committee.
Sometimes you might get a vet serving on the AEC as well, in which case they have a bit more influence. But if the institution has an animal care manager or animal ethics officer who is quite often a vet, then really their remit is more care and veterinary attention to those animals and training for the researchers that are using those animals. They may be able to decide if they think the research has got to a point where it has to end because it's reached an inhumane point, but they might not have that much sway about whether the research can take place in the first instance or not. So a follow-up question, how do we target animal welfare officers in terms of sharing information, or I'm not really sure exactly what that means, in terms of sharing information or engaging with them? Natalie has quite a lot of outreach with the animal welfare officers and speaks to the AECs. I'll let you add to anything to that, Natalie.
Yeah, so that's part of my role. Really is to reach as many animal welfare officers and people involved in this area Australia-wide. So that's I definitely speak with many of them throughout Australia every year, and advise them what the alternatives are and what how I can specifically work with them for the types of animal research that are going on in that university. Not all unis have animal biomedical research going on. So yeah, it's just a case of speaking to everybody.
Yeah.
And sorry, I should, on that first question, what role do veterinary practitioners have to influence people? I think it depends on the money that's being allocated at that particular university or institute, because there are sometimes roles called animal advisors or something similar to that, and at that point they can sort of give advice on what type of research could be conducted. But from my understanding, I think those roles are only in quite well-funded universities, and I know that there's been a lot of cuts throughout WA, certainly, and I'm not sure if that's the same throughout the rest of Australia, but with the university situation. So it does vary, and it is different everywhere.
Yeah.
Oh, thanks, Belinda. Yep.
Yeah, Belinda made a comment as a vet that she agrees with everything said. She's known other vets serving on AECs, and they've tended to focus more on refinement, such as analgesia rather than replacement. So just echoing that their role is more to reduce the suffering than kind of question the use in the first place. But really, with the vets and the animal ethics committees and the animal welfare officers, will also, as well as one-to-one interactions that Natalie may have, we will be kind of trying to target to speak at conferences where they may be the particular audience. We have particular web pages where we'll link to different resources. If there's developments in non-animal methods, we'll contact the universities to share about those particular developments to bring it to their attention as well. So question, is it worth highlighting the universities who do and don't condone animal testing? I wouldn't say there's any in Australia that are completely opposed to animal testing, unfortunately. Internationally, there may be some examples there. They would typically be perhaps universities that don't have life science courses or not a focus on life science courses, so that's a little bit different. there isn't so much at that particular list. I know in the UK, Animal Aid had a campaign. I think it was called Universities Challenge, and they have a directory of universities that are using animals or have positions where they're not using animals. But quite often, a university may work in collaboration with another university, have a joint project. So it's quite hard to isolate one that has no involvement whatsoever. But as I said, there is that UK resource. There's also in the US, there's directories of universities that have specific departments for non-animal research methods, which have a specialism in that. So that's probably the closest you could find to something that's showing which one's a bit more progressive than others. But those same universities will also be using animals as well. So it's not as clear cut to have a kind of a good list and a bad list.
And I can see Susan's question, are medical students expected to test on animals to be able to receive their PhD, for example? And how regulated and monitored are students to ensure the least amount of stress or pains inflicted in animals? I'll start with those two and then answer the last part. And so I don't think there's not an expectation that you have to use animals, but it would be dependent on the particular research project. And I'm just assuming with this one, so there are joint degrees in Australia. I think they're very new, but joint medical and PhD degrees. So I'm not sure if that's what, Susan, you're referring to, but otherwise medical students sort of can do their own degree, and then PhD is sort of considered a separate thing. But yeah, I don't think there's any expectation to test on animals. I think that would vary from university to university, or to use animals in the medical degree that I'm aware of. And for PhD students, say in biomedical research, like I said, there's not an expectation to have to use animals, but it would depend on what that research project was, who the supervisor was, and yeah, if they choose to do that, then they're probably expected to complete the project, I suppose. Yeah, I'm not really too sure how to answer that, but how regulated and monitored are the students? Again, I guess it's very institutional. They should be fairly well monitored. They should be trained to do a particular method, and they should always be supervised, particularly if they're honours students, maybe later into the PhD, they may be more competent and more able to sort of perform some types of experiments on their own, but they should always have oversight from the supervisor. I don't think that's probably not an institutional thing. That's probably a supervisor specific issue, how well supervised they are. Unfortunately, I know with my PhD, some of my supervisors are definitely more involved than others, so I'm sure everybody has that experience. And the last bit, are tests repeated over and over by different students in the name of their individual learning? Probably not too sure how to answer that part of the question, unfortunately. Sorry, Susan.
I think that's in relation to, is there something in the syllabus that's repeated every year for the students? Like in the first year, they do a particular procedure that might involve rats or a particular test.
Not in a PhD. Yeah, not in a PhD as far as I know, because that would be research project dependent. A PhD doesn't have a course. Well, you can choose to do coursework units, but usually they're sort of statistics and things like that. So yeah, I'm not sure with maybe some master's projects. Yeah, I'm not too sure what that looks like throughout Australia, but definitely with a PhD, no. And with the medical degree, I would guess not. I think that would probably vary from university to university, but I don't think so. Well, that's a good point, Elizabeth. I'd love to have some well-crafted key messages to advocate to international medical and veterinary students about animal testing. We do have a page for students and educators. I'm not sure if some of those the messages on that page are suitable, but our resources on what alternatives are available are on there. Oh,
Yeah,
Adam's already just linked to that. Yep, sorry,
Yeah,
I say that.
some of that would link to pages where you can get kind of sample conscientious objection policies and things like that. It might need to be modified slightly depending on the country. I know you said international use, but there are some sample policies there.
Oh, you're referring to conscientious objection, Rachel? Yeah, sorry. Yeah, which is, I think that's Elizabeth's next question, isn't it?
Yeah. Yeah, and that's a difficult one because according to the Australian Code, each university that's using animals should have a conscientious objection policy, whether that's a standalone policy or incorporated into the animal use policy. But we have found that they vary quite significantly between institutions. Some are very strong, and some are very much a case of it depends on the individual supervisor and course as to how flexible they are with that component of the course and whether a non-animal method can be accepted or not. So they should have a conscientious objection policy, but it might be the policy could be worded that almost if you're not willing to use that method, then you may fail or shouldn't enroll in the course in the first place. And others are really, really strong. So yeah, I wouldn't say there's always an ethical opt-out, but there should be a framework by which they can at least have a process if they object. Sorry if the answers are sometimes a bit vague. It's very much a system that varies between institutions, and there's systems that exist in practice but aren't always implemented consistently. So it's hard always to give an example for every situation. As I say, thank you so much to Natalie for your really informative presentation. I hope it gave everyone a bit of a overview of what the landscape is like in Australia and a bit of hope that there are some recent developments, and we will keep pushing for more funding and for the infrastructure that can support the change in direction where we need to be.